Why India is still behind China and the US in digital health adoption, especially in EHR and EMR systems. These systems are the foundation of any digital health ecosystem. So today we'll compare India, China and US backed by evidence that how these three countries have been progressed so far and where India stands.
We've got the most inefficient healthcare system imaginable. We're still using paper. We're still filing things in triplicate. Why wouldn't we want to put that on an electronic medical record that will reduce error rates, reduce our long-term costs of healthcare, and create jobs right now?
There was 85% adoption in China and became a global leader in digital hospital adoption. For US, 30 years, for China, 15 years.
Digital health adoption. Learn, implement, transform.
Hi everyone, welcome to my first blog on my channel, Digital Health Adoption. Today I want to talk about something that I have been closely involved for years. Why India is still behind China and the US in digital health adoption, especially in EHR and EMR systems. These systems are the foundation of any digital health ecosystem. If hospitals or clinics don't record patient data digitally, then things like telemedicine, AI-based care, be it remote patient monitoring, population health management, interoperability and care continuity simply can't function effectively. Everything starts with digital patient records. So today we'll compare India, China and US with backed by evidence that how these three countries have been progressed so far and where India stands. Let's talk about US. US has achieved 96% EHR adoption. According to BMC Health Service Research, by 2021, 96% of US hospitals networks were using certified electronic health records. That is almost a fully digitized hospital network. But it took the US almost more than 30 years to reach this level. The major shift in their adoption happened post 2009. So today we'll talk about before 2009, what happened in US and what happened in after 2009. So before 2009, these were the foundation years. In 1991, as per Institute of Medicine report, the first major national recommendation to adopt computer-based patient records. This was the first major push in US. In 1996, HIPAA came in, introduced the first federal privacy and security standards for electronic health information. In 2004, Office of the National Coordinator for Health Information Technology established. So if you see these developments, there was a clear focus to move step by step in US. Office of the National Coordinator for Health Information Technology, call it ONC, created a central federal agency to guide national digital health strategy, standards and interoperability. In 2005 to 2008, they established a regional health information organization and early certification efforts like EHR certifications, EMR certifications. So these were the phase where they conducted various pilot programs, started to build early interoperability networks, and the first certification standards were launched. But after all the efforts, EHR adoption still remained low and around 12% of hospitals. And after 2009, the major push was created.
The reason is we've got the most inefficient healthcare system imaginable. We're still using paper. We're still filing things in triplicate. Why wouldn't we want to put that on an electronic medical record that will reduce error rates, reduce our long-term costs of healthcare, and create jobs right now?
After 2009, these were the years where they pushed EMR and EHR heavily. In 2009, the HITECH Act came in. Billions in incentives made EHR adoption a national priority. Like 30 billions government invested through this act to push EHR adoption. And 2011 and 15 were called meaningful use. Staged rules for hospitals to adopt and meaningful use of electronic health records. And these are all the incentives were pushed for the meaningful use. If they adopted, they will get the incentive. If they don't adapt, they will not receive the incentive. And 2016 to 21st Century Cures Act and reduced clinical burden and improved interoperability. We'll talk in a special blog for interoperability, but in nutshell, to link various applications and gather insights through a common portal. Basically, if you see data collected from devices, data collected from ambulance, this all data should come into place and we need to see the insights of everything. So that interoperability issues still exist in the system and what they have solved almost in years. And 2020 information blocking rule made it illegal to block or delay patient access to their own data. They started punishing those delayed these efforts. Then in 2022, they established TEFCA, Trusted Exchange Framework and Common Agreement, established a nationwide framework for secure, standardized health information exchange across states and networks, which is very, very important. In India, this is the need of hour to establish health information exchange across the states having a common standard. The fast healthcare interoperability resources API, and this enabled modern app-based data exchange and accelerated digital innovation through standardized and developer-friendly interfaces. So just imagine in India, any company, any startups, any government having an app for patient use, for population health management. And if people are using different devices, different other apps, if the app that government or any other startup is building and they have dependency on other apps to collect data and give insights or any risk certification, any recommendations and all. So this FHIR APIs enabled made it possible anywhere. And you see the results. 12% EHR adoption in 2009 increased to 96% by 2021. A policy-driven, incentive-driven, 30-year national mission that transformed the US hospital ecosystem, one of the most digitized hospital network of the world. Let's come to China. China has achieved 85 to 90% EHR adoption so far. A study shows that China reached 85.3% hospital EHR adoption and 88% in tertiary hospitals. China's progress was fast because it was a top-down and mandatory policy. So China's foundation years are like 2003, where SARS outbreak was there, and actually it's opened eyes and triggered digital health reforms. In 2006, they brought in national EHR and EMR standards. China issued the first national health data standards. In 2007 to 2009, they conducted these pilot programs in big cities. EMRs, PACS, and labs. The systems were basically tested and refined and got ready to deploy in large scale. China pushed heavily after 2010. In 2010, the new healthcare reform plan came in. Mandatory hospital digitization with massive government funding. In the US, the one important thing was common here, heavy funds. And in China, the same thing happened here with a massive government funding in 2010, which in US in 2009, after the HITECH Act, they pushed around 30 billion US dollar into the system and to accelerate the progress. In China 2011, EMR maturity grading system, they like similarly in US, and 2013 national data sharing mandate. In US, the similar line, they establish TEFCA, like tertiary hospitals required to implement EMRs and share data. 2016, they made the plan Healthy China 2030, roadmap for smart hospitals and digital public health. If you see everywhere there are clear vision to improve digital health adoption and address the bottlenecks and to move on. In 2017, Internet Plus healthcare policy, this actually boosted telemedicine, online prescription, virtual hospitals. The basic need is the EHR and the EMR adoption. Post that, these are the services which actually built on the top of the EHR and EMRs. So once we establish EHR and EMR, then only we can explore the other verticals, other category of services. In 2020, there was 85% adoption in China and became a global leader in digital hospital adoption. In 2020, COVID digital acceleration, nationwide QR health codes and real-time reporting systems. And 2021-23, like smart hospital plus AI push and shift from EMRs to AI-enabled cloud-based digital hospitals. And all these efforts in China, from low adoption to 85 to 90% in 15 years. For US, it took 30 years. For China, it took only 15 years. A fast, top-down, nationally coordinated transformation that made it to achieve this number. India has achieved 30 to 35% EHR adoption so far. These numbers and this data that I have gathered, I will put it on descriptions so you can refer to this. So public hospitals and smaller facilities are still far behind. India's journey is bottom up, driven by pilots, startups, partial policy support so far. There is a lot to do. Let's talk about what has happened in India so far. In 2000 to 2005, the early HI systems, big private hospitals started using billing and admin software and all. In 2005, there was National E-Governance Plan, digital infrastructure across sectors. But if you see, there is not a strong focus on EHR and EMR adoption. In 2008, telemedicine conducted by ISRO and Government of India, early remote consultation for rural areas. But if you see, these are the next step. The first thing is to focus on the EHR adoption. If it is not in place, we should not focus on the other verticals. Definitely, we should do pilots, as many pilots for telemedicine, AI and all, but our focus should be on EMR and EHR. India has made a steady progress, but the real transformation will happen when digital health becomes a default requirement, not an optional upgrade. With the Ayushman Bharat digital mission, stronger national standards and state level mandates, India is finally poised to make a big leap, just like the US and China. The next decade is crucial. The hospitals, policymakers, startups, and clinicians work together. India can move from fragmented digital system to a truly connected nationwide digital health ecosystem. That's exactly what this channel will explore, the challenges and opportunities and the roadmap for India's digital health mission. Thanks for watching and stay tuned for more deep dives in digital health adoption. Thank you again.
Digital health adoption. Learn, implement, transform.